Hi, I'm Dr. Milescu. I am an adjunct professor at Daytona State College-Deland campus, and we are here today to dissect the eye, cow eye. And for future students, this will be a good reference prior to dissection. So without further ado, let's begin. So the first thing you want to do, we've already gone through a previous video that I uploaded on the eye. The eye model we already discussed, so a lot of the structures that we're seeing in the eye model, hopefully we can identify here. So this is a very large cow eye. We're going to remove some of the fat as well as the muscle. Remember, if you're looking at the eye, so it turns up and down and all around, you have a superior rectus, an inferior rectus, a medial rectus, and a lateral rectus muscle. And then you have a superior oblique going diagonally and an inferior oblique going diagonally at the bottom below the eye, okay? So we're going to dissect now. Let's begin. I'm going to start by taking away all this fat, and I'm going to bring this closer to the screen so you can see, even without dissecting, you can really take a look. That's the optic nerve in the posterior aspect of the eye. And this right here, as you can see, is the cornea. And then the deep tissue right here, and you can feel it, that's your sclera. Okay, so the sclera is very tough, rubbery tissue, so you don't really want to cut that off because you want to be able to identify it. All right, so let's begin. I'm going to start dissecting away some of this muscle. You want to use your scalpel like a pencil, okay? And try not to saw too many layers. Just go through with one nice swoop like this. And I'm going to continue cutting some of this away because we don't need all this muscle. We need to be able to isolate the main parts of the eye. So here I go. I hope this doesn't gross you out. If you're all going to be future medical professionals, this is a good start here to really not get affected by the smell or the tissue. So bear with me. This video might be a little boring. You can fast forward this part if you want. But I'm taking my time, as you should as well, so you don't cut yourself. Have a good grip on the eyeball as you cut away all the fat and muscle. All right, so I'm going to go all the way around. And the final practical will include a dissected eye. So you really should get familiar with all the structures seen on the cow eye. All right, here we go. I'm getting there. So you really got to do a lot here. And you know, you could also use scissors. I opted to just use a blade in this case. This is a number 10 blade. But it's doing a good job. If you feel confident with your quote-unquote surgical skills, you can use the blade. But if you are not confident, it might take a little longer, you can use scissors and forceps. Okay? All right, so here we go, getting closer, getting way closer. Here I go, almost there. I hope this video is not too boring, but it's fun to watch the dissection take place, I'm sure. All right, so you want to, this is quite a dull blade, but I guess it's better that way, especially if you're a beginner at cutting. Here we go. And you want to be very careful not to cut the optic nerve, as you can see right there. So you can see what I'm doing is I'm cutting around it so that I'm not taking away that very vital structure that needs to be identified. Since it will be on your practical, you need to be able to identify the optic nerve. All right, so now that we've got that out of the way, the remnants of a true eyeball here, as you can see, and I'm going to start dissecting away some more of this, which pretty much is still connective tissue, muscle tissue, and now we can see more of the eye and that really tough sclera out there. Okay, and then here you can see the cornea. And then here you can see the optic nerve. Okay, so let's continue dissection. So I'm going to cut all this out so you can see a little bit more. Getting there, slowly but surely. And this tissue is really tough, rubbery tissue. Cadaveric tissue tends to be quite dry. And be careful, once we start cutting through this eye, we have the aqueous humor in the anterior chamber, which we learned through the last video, and we have vitreous humor in the posterior cavity or chamber. Let's call it cavity because that's what's in the book. Here we go. Much better. Take a peek. All right. So we still dive further into the layers. Still more connective tissue and muscle here. So I'm going to take all that out as again on this side. Let's see. This blade is truly, truly dull, but I will get through it. Here we go. I'm getting through some muscle too. And as I'm cutting away, I'm very careful not to rupture the whole eye, especially through here, because I don't want fluid to squirt out, so be mindful of that. And you'll be dissecting with a mask. I just, obviously I'm doing a video, so it makes more sense not to have a mask on to show you as I'm speaking to you my excitement at seeing a beautiful eye here. All right, so we're getting really close now. I'm going to start taking some of this away, and then we'll get down to dissecting fully the eye. So, almost there. And it doesn't help that I have a lot of OCD in my genetics, so I really like to skin it down to that sclera and get all the muscle and connective tissue off of it. Doesn't have to be perfect, but of course, I'd rather have a long video and have a perfect eye model here for you. This will be a perfect specimen once I remove all of this excess tissue, which I know is taking forever. Hopefully fast forward if you're bored with all my conversation with you. There. Really close now. Okay. That's as good as it gets. All right. So if I really like push on this, you can see that there's fluid in there. That's the aqueous humor in the anterior chamber. And you could see that tough sclera, which part of it was removed along with, so you can see here on the side, along with fat and muscle. So all the fat and muscle is gone. This is pure eyeball now. And if I can isolate some more fat, I can really look and see this very long optic nerve coming out posteriorly. See that? Okay. So now the fun part, the fun part begins. So now this video will not be boring. So the way you want to start is you want to hold the eyeball with your index finger and thumb. And then to be safe, you want to place the handle right by your palm and hold it like this so that you've got safety measures here so that the blade doesn't slip onto your finger. You want to go just posterior to the cornea, as you can see here. So you want to start like right about there. And you're going to saw all the way into it. I would start vertically like this, okay? And puncture it. That's the hard part. There we go. It's punctured. And up there comes the vitreous humor. And I'm going to just steer clear of it so I don't get squirted. There we go. Got it. Got it, got it, got it. And then you go all the way around with the cut. That sound is all the fluid coming out. I will show you in a minute once I'm done with the dissection. This is the hard part, the hardest part. And the hardest part is to keep that eyeball in place. So we're almost there. And you can see all that fluid coming out. There it is. I almost have most of it out. So I'm halfway there. I'm going to stick my thumb through here so I can see how much more I have left. So here I go, keeping it open. There we go. And we are almost there. 90% and 100%. Boom. There it is. All right, let me get that connective tissue off. And I will show you the beauty of this eye. All right, so here we go. So here, as you can see, I'm going to show you with my probe. Right in here, you see that gelatinous fluid? That's the vitreous humor. And it's behind, right here, it's posterior. It's in that posterior cavity. So here it is coming off. I hope you're not getting grossed out, but this is the gelatinous. See how gelatinous it is? It literally is coming down like jelly. Okay, so that, look how stretchy it is. I don't know if you can see it in the video, but I am now removing the vitreous humor from that posterior cavity. Okay, so once I got that off, we have two sections of this eyeball. The anterior section, which I'm going to show you now and identify all the parts. I'm going to take my forceps and finally get rid of all this vitreous humor, which is quite extensive. And some of this connective tissue, I'm going to use a blade to get that off. There we go. And look how pretty this is. Now see this dark color around the cornea. Whoops, almost dropped it. That dark color around the cornea. Okay, that's the sclera, that's the outermost layer. It is very rubbery, very strong. There's the cornea. And if I poke my thumb through, and I can actually turn it around for you so you can see. Do you see that slit? It looks like a slit. In cows, the pupil looks like a slit. In humans, it is round, as you know. All right, now I'm going to point to the ciliary body. These striations are right here. You can see the striations. I don't know if you see the striations in this video, but there's the striations. Okay, so that's the ciliary body. And the ciliary body's function is to assist the lens in it thinning out and widening according to distance and proximity. All right, so you've got the pupil, which is a slit, And let me show you the lens, which I haven't removed it. It's in that posterior section, because if you think about it, it sits like this right behind the pupil, which is right there. So let me take out this beautiful lens. There it is. You see, I'm taking it out. Look at that beautiful lens. It looks like a gumball. In real life, it's very soft. It's not hard like it is here. It feels, it's denaturation, of proteins. So proteins denature, and then cadaveric tissue becomes hard. So that's what this looks like. If you press on it, it really does not bend at all. It's hard as a rock. It's like a pebble. And it's pretty fascinating to feel and touch. So that's the lens of the cow. So we've so far identified the cornea, the sclera, the pupil, okay? Remember, in the anterior cavity right here behind the cornea is the anterior chamber. And inside the anterior chamber is aqueous humor. In the posterior chamber here, which you saw the gooey stuff, that was the not aqueous, but instead it's called vitreous humor because it was gelatinous. Okay, so what are the structures anteriorly besides the cornea? The colored portion of the eye is called the iris. So that's right behind the cornea here. The pupil, as you know, adjusts to light, and here in the cow, it's a slit. And then if you turn it, the posterior aspect of this anterior eye, after cutting it cross-section, you can see the ciliary body, really close up, ciliary body, okay? And that's pretty much what you need to identify. Now, here, like saran wrap, you can actually, I don't know if you can see it in the video, but when you're dissecting, you'll see that there's these little tiny ligaments right there. And those are suspensory ligaments that support and hold the lens in place. So it would hold the lens like this, okay? All right, so I'm done with the anterior portion. Now let's move on to the posterior portion. Now, this whole entire cream-colored beige section, do you see that little thin layer? That's the retina. So all the cones, which are the receptors for daytime vision, and rods in the periphery. So the cones are in the macula densa, which is adjacent to the blind spot, right, which is called the optic disc, okay? But the entire retina has cones and rods. Cones are for color, okay? Rods are for at night. In this case, we have a cow, and cows are nighttime creatures, and so they're able to see at night. They have nighttime vision. They're also daytime creatures. I meant to say that they can see at night, unlike us. And so what happens is there's an extra layer, and if you look at this little diagram here, let's see if I can show it to you. Where is it? This beautiful blue color right here, okay? It is called tapetum lucidum. Tapetum lucidum. And that structure behind the retina is what gives them the ability to see at night. So now what I'm gonna do, let me move the eyeball near the camera so you can see. I'm gonna really nicely peel off right there, as you can see. I'm going to peel off the retina off of that posterior chamber. I'm going to try to be very delicate about it because this is very, very thin tissue. And now check it out. It's all bunched up. And where is it stuck? Check it out. How beautiful is this dissection? See that? All the axons are going to that posterior aspect of the eyeball, which is what? That's the optic disc. Okay, that's the optic disc, and it's the blind spot. And all the axons meet and become that whole big nerve called the optic nerve right in here, all right? Cranial nerve number 2. There it is, cranial nerve number 2. Cranial nerve number 1 was olfactory. So right there, you can see I'm pulling it off now. I'm going to pull it all off. And all that's left is a little nub, and that identifies the optic disc. Okay? So there it is. Okay? So besides the optic nerve, the vitreous humor, we mentioned the suspensory ligaments. The sclera is the outermost layer. What's the middle layer? The choroid. Hard to tell here. In terms of this dissection, we can probably consider the choroid as this whole section right here. And then the black area, according to this, is called the ora serrata. So all the way back here, ora serrata. But this beautiful blue color, see that? That is your tapetum lucidum, okay? Now if I take all this off, you will see underneath that tough sclera. So now I'm going to take this tapetum lucidum off. There it is. Slowly trying to peel it off. It's very difficult to take it out in one piece. It is possible, but you got to be very gentle. So I'm going to just, with my pickup, with my little forceps, I'm going to slowly peel it. I'm getting there. Try not to tear it up. I don't know how good this video will be, but hopefully it helps all of you. Oh, this is coming out really nice. It's coming off very nicely. Just try not to tear it up. It's paper thin. I'm going to go underneath it. Let's see if I can grab it. Getting a little impatient. But I think I got most of it. Here we go. I did. All right. So that's it. Look at that. That's pretty cool. So I think that's pretty much it with identifying that sclera. I don't know how else to show you unless I try to peel this connective tissue off, which is very difficult. But sclera is the outermost layer, and then the middle layer is what? Choroid, right? And then the deepest layer is the retina, which I just showed you. Took it off. Now look at this beautiful, shiny tapetum lucidum. Matches very nicely with the picture. So here's the picture of it, okay? And then here's mine. Gorgeous. In fact, if we can paint a wall with this color, nature is more beautiful than paint. All right, so that's pretty much it. I'm just going to go through the list here. This is the checkoff list to make sure that we've identified all the structures. So the aqueous humor is located in the anterior chamber, which we discussed. So when you're dissecting, you're going to see it in the front, anteriorly, along with the cornea. The anterior chamber has the aqueous humor. To review, you've got your pupil there, your ciliary body, suspensory ligaments holding the lens, which should sit like this. Okay. And then right behind the lens, you're going to have the posterior cavity. And the posterior cavity has that gelatinous fluid, which I showed you. And then you see, the first thing you'll see is that retina, which was that beige color that's paper thin, and I removed it. And then it all bunches up when you like tease it with your pickups. It all bunches up to that posterior aspect, the blind spot, the optic disc. and the axons meet up and become that optic nerve that comes out posteriorly, and you can see it right here. So, and then once I removed the retina, we saw the tapetum lucidum. I have trouble pronouncing this. Tapetum lucidum. So once we remove that, you can really see that tough layer, the sclera. All right, so other than that, let's see. We talked about the sclera, vitreous humor, suspensory ligaments, retina, pupil. The ora serrata, not as important, but that's that whole black region that's superior and just behind that whole tapetum lucidum. Okay, it's superior and it's all posterior, superior and posterior, superior above the tapetum lucidum. And we talked about the lens, that it adjusts to light, but in a cadaveric specimen like this, it's hard as a rock, like a pebble. And the only other thing I didn't mention is the iris, and the iris is really close to the pupil. It's the colored portion of the eye. I believe that's it. Okay, I hope you enjoyed this video. Sorry for the long wait as I removed all this. So you can see, why is there so much fat and muscle? Well, first of all, the eyeball has to be protected. So that's why we have a lot of fat posteriorly. So posterior aspect of the eye has a lot of fat, okay, so for cushion and protection. And we need to also have muscles, and we talked about the muscles to review one more time. So if you have the eyeball, superiorly is the superior rectus, inferiorly inferior rectus, medially medial rectus, laterally lateral rectus, oblique like this, superior oblique, oblique like this, inferiorly is the inferior oblique, okay? All right, I will see you in lab. I hope you enjoyed this video, and good luck on your final. You will have a dissected eye. Unlike me dissecting here in this video, it'll be nicely dissected. We'll have structures that you need to identify. We went over all of them on this list, so when you come into lab, make sure you take a picture of this, and go over the entire list as I did just now. Okay, yes, I know all of them, but I still always have to go through the list to make sure that I've mentioned all of them in this video. If you have any other questions, meet me before or after lab. All right, have a good night.